Hello, this is Vema Vishnu of Block C, here to explain about the anatomy of one of the accessory organ, the pancreas. Here I will be discussing about its appearance, location, shape and size, parts, its external features, relation, internal ductal system, blood supply, nerve supply, lymphatics, function and clinic anatomy. First, looking into the appearance of the pancreas. Pancreas is a soft, lobulated and an elongated organ. It is located in the epigastric, left hypogastric, small part of the umbilical of the abdominal region. It is located in the posterior abdominal wall, transversely at the level of first and the second lumbar vertebrae. Shape and size. Pancreas is a J-shaped or retort-shaped organ. It weighs of about 90 grams. Size. It is 15 to 20 centimeter long, 2.5 to 3.8 centimeter broad, 1.2 to 1.8 centimeter thick. Pancreas is devoid of peritoneum. Thus, it is called as retroperitoneal organ with the exception of the tail. Parts. The pancreas is divided into 5 parts: the head, the neck, the body and the tail. Now, let's look into the external features and relation of each part of the pancreas in detail. First, going into the head of the pancreas. The head of the pancreas is an expanded region located within the C-shaped concavity of the duodenum. The head of the pancreas projects inferiorly and posteriorly behind the superior mesenteric vessels and forming a process called the uncinate process. What are the external features of the head? The head has 3 borders: the superior border, medial border and the inferior border. The superior border is related to the first part of the duodenum, the superior pancreatoduodenal artery. The inferior border is related to the third part of the duodenum and the inferior pancreatoduodenal artery. The medial border is related to the second part of the duodenum, the bile duct and the anastomosis of the 2 pancreatoduodenal arteries. It has 2 surfaces, the anterior surface and the posterior surface. The anterior surface of the head of the pancreas is related to 3 structures from above downwards. It is first part of the duodenum, transverse colon and jejunum. The anterior surface of the uncinate process is related to the superior mesenteric vessels. Then moving on into the posterior relation of the head of the pancreas. It is related to the bile duct, inferior vena cava, the right crest of the diaphragm. The posterior surface of the uncinate process of the head of the pancreas is related to the aorta. Next part that is next to the head is the neck. It is a constricted region located between the head and the body. It is directed forward, upwards and towards left. It has 2 surfaces, the anterior surface and the posterior surface. The anterior surface is related to the pylorus of the stomach and the peritoneum of the posterior wall of the lesser sac. The posterior surface is related to the termination of your superior mesenteric vessel and the beginning of the portal vein. Moving on to the next part is an elongated part extending from the neck to the tail, that is the body. It is triangular in cross section. It has 3 borders, that is the anterior border, superior border and the inferior border. The anterior border of the body of the pancreas provide attachment to the root of the transverse mesocolon. The superior border is related to the tuber omentum. The inferior border of the body of the pancreas is related to the superior mesenteric vessels. And it has 3 surfaces: the anterior surface, the posterior surface and the inferior surface. The anterior surface of the body of the pancreas have a concavity which is directed forwards and upwards. It is related to the stomach and the lesser sac. The posterior border is related to the left kidney, left renal veins, aorta, and the left crus of the diaphragm. The inferior surface of the body of the pancreas is related to the duodenojejunal flexure and the splenic flexure, also called as the left colic flexure of the large intestine. Next, the tail part of the pancreas. The tail of the pancreas lies in close proximity with the hilum of the spleen. It covers the lower part of the gastric surface of the spleen. It lies within the linorenal ligament together with the splenic arteries. It is covered by peritoneum. During splenectomy, we must take deep care into the tail part of the pancreas, because when the spleen is removed, sometimes we may also remove the tail part of the pancreas. Since the tail of the pancreas contains a cluster of islets of Langerhans, the patient may land up with diabetes. Next, we will move on into the blood supply of the pancreas. The pancreas is supplied by the pancreatic branch of the splenic artery, superior pancreatoduodenal artery, and the inferior pancreatoduodenal artery. Next is the venous drainage. The venous blood is being drained by the superior mesenteric vein, splenic vein, and finally into the portal vein. Next is the lymphatic drainage. The lymph is drained by the pancreatosplenic lymph node, superior mesenteric lymph node, and the celiac lymph node. The nerve supply is by the parasympathetic vagus nerve and sympathetic splanchnic nerves. Next is the ductal system of the pancreas. It has two ducts called the main pancreatic duct and the accessory duct. The main pancreatic duct is located in the posterior surface of the pancreas. It receives small branches and showing a V-shaped pattern called the herringbone pattern. The main pancreatic duct combines with the bile duct and forming the hepatopancreatic ampulla or ampulla of Vater and opens into the second part of the duodenum and the major duodenal papilla. The hepatopancreatic ampulla is controlled by the opening is being controlled by the sphincter of Oddi. The second duct is the accessory duct. It drains the lower part of the head of the pancreas and opens into the minor duodenal papilla in the second part of the duodenum. Next, we will be talking about the function of the pancreas. We know that pancreas is partly endocrine and partly exocrine organ. The endocrine part produces hormone. It is being produced by clusters of cells called the islets of Langerhans. The hormones are the insulin and glucagon, which maintain the blood sugar level. Next is the exocrine function. The exocrine part is made up of the acina cells producing the digestive enzymes that contains lipase, trypsin and amylase that helps in digesting the chyme produced by the stomach. And moving on into the clinical anatomy of the pancreas, it has pancreatic cancer and pancreatitis. Pancreatitis is just nothing but the inflammation of pancreas that is due to the digestion of its own cells by the pancreatic enzymes. It may occur due to the gallstone or due to overusage of alcohol. And that's all about the anatomy of pancreas. Thank you.